Hi, guys. It's Dr. Shelley Coleman Glover. It is Friday. It is December. Uh, what is the day now? Lord have mercy, 18th, and it is 4 o'clock. So it is time to go live discussing all things COVID and bring you a little bit up to date on what's been going on over the last week. Uh, and obviously, next week is Christmas. So, little housekeeping, we will not be coming on live for Christmas. If there's something exciting that is going on, then I may do a quick video. If it's really, really exciting, then what I could do is have you guys. I may go live on Saturday, but stay tuned. I will definitely post as far as that's concerned. I will let you know that I will be getting the vaccine on December 23rd. So I will probably at least give you a little video of me getting the vaccine and let you know if I get any side effects from it. And so there may be a little bit of information on December 25th. Otherwise, and then of course, the following week is January, is New Year's. So stay tuned. I will post as to whether or not we're going to be going live, but probably once again, we'll not go live on the first. So it would either be that Saturday afterwards, and or I may pre-record something that you can watch at your leisure. So let's go over the numbers. And then I have Dr. Evans, who has been with us a couple of times on the interview as well, to give us an update on what's going on hospital wide as far as COVID numbers, etc. So hopefully you guys give him another warm welcome. So let's go over our numbers real quick. And then we will delve into that a little bit more. Right now, we're in the in the worldwide, we're at 75.2 million cases of COVID, 42.5 million recovered. So that's always a blessing. But we have 1.67 million people that are deceased from COVID. So that, of course, is not a pretty picture. We do not like that at all. Within the United States, we're at 17.3 million cases. And we have over 311,000 people that have died of COVID. The Florida, my office is located in Central Florida. Dr. Evans and I both live here, and so we always give our Florida data out. And we're at 1.17 million cases and 20,000 deaths within the state of Florida. Orange County, which is where I am located, is at 66,000 cases, almost 67,000, and 696 deaths. Oh, also, let me know if you guys can hear me well, because we were having a little bit of technical, and it sounds a little funny to me. Dr. Evans, can you hear me okay, or do I sound funny?
I hear you very well.
Okay, good, because I hear a little something. So if you guys are having any trouble listening, I'm hearing, please, by all means, let me know. Um, Within the going back to the worldwide data real quick, we're still, the numbers are still the same as far as the United States is leading with the number of cases as well as the number of deaths, and then India, then Brazil, um, and then Russia, and then France. And so those numbers have pretty much stayed the same. Once again, with Brazil having more deaths than India, even though they have less cases of COVID overall. Of note, Mexico, even though it's further down the pipeline, they are extremely concerned because of their hospital and ICU capability, and they have gone into full red zone closure. They will be shutting down to just essential um, activities through January 10th, and so they're doing that as a whole country. So something that uh, obviously doesn't happen here in the United States, where we all allow our states to be able to so far mandate what it is that they do and don't want to do. So I'm going to let Dr. Evans give us a little bit of insight just in case he has to jump off. And let's give him a warm welcome. Hold on, I got to find you real quick. 1 second. And there he is. And he is the trauma medical director at Central Florida Regional Hospital in Sanford, which is right above Orlando. And like I said, we've had him on a couple of times. Welcome back again.
Thank you.
So
I
what's been
delayed
going on?
a
What are
little
you
bit?
seeing now? Are you seeing the numbers? I mean, we know that Central Florida is doing better than many other places across the country. But from what I'm seeing, we are starting to see the crunch here. We're not in crisis yet, but we are seeing definitely a big uptick in the number of not only just COVID cases, but also just availability within the hospital.
Yeah, so Central Florida area is following the rest of the world and the rest of at least America in the rise in the number of cases that are popping positive. um, the hospitalizations then also rise. Now, thankfully, just like everywhere else, at least in America, we've not seen the same percentage of death in comparison to those people who are positive. But that number is still rising because of the number of people overall that are rising. So our hospitals are full. The ICUs are not at critical level yet, but the ICUs are more full than usual, and so we are really much very carefully keeping an eye on that. I in my hospital here, we're on the north side of Orlando, a little smaller hospital than the larger ORMC or Advent Health, but all of these hospitals are either close to capacity or at capacity. And so in this area, it's in this time. So it's something that we have to continue to be very vigilant about. I know you're going to get into this, but part of not getting sick and not even getting positive as far as with the virus is social distancing, is still wearing your mask, is being very vigilant about hand washing, etc., being very careful about doing these things.
Correct. Definitely. And we go over this every. Hold on now, I can't find myself. Hold on. Hold on. I'm playing with a new thing, guys. So give me 1 second. Where did we go? Where am I? I'm nowhere. Okay, hold on. Okay, there I am. So, they probably just heard a voice appearing, but anyway, the we go over it every single time, and the bottom line is that it's everything in together. It's not.
Right.
We are excited because we have new medications out that are more effectively treating our people that get COVID. We're excited because of the vaccines. That's obviously the big topic, and we're going to spend the majority of the time talking about. Um,
Yes.
but it doesn't mean that because you've gotten the vaccine that you don't have to do all the other things, because we're still talking about, when to reiterate, there are over 340 million people that live in the United States, and
Right.
we only have, and it's not a little, I'm not belittling the number, but we're at 16 million, what did I say, 17 million that have the virus. And so we're not, um we're still in the, so 17 million is 17 million too many that have the virus. But
Hmm.
when you're looking at 340 million people that live here, we're not,
Hmm.
this is not something that's going to, uh, where we're going to have enough vaccinations to get around to people very quickly, where we're going to be able to, get this quote unquote herd immunity that you hear people talking about. I mean, that would be just, we were talking about now, in order to get herd immunity, over 70% of the population getting COVID.
Right.
And then even with a 2 to 5%, mortality rate, we're talking about a lot of people becoming severely ill and a lot of people dying. And we just can't have that. So we do want to do all the things that we've been reiterating over and over and over again, and everybody knows what those are, and you just have to do them. You just have to do them. I think that it's interesting, because I traveled. I traveled this past week, and I went up north, and I can tell you that it's definitely a different feel up in the Washington, D.C. area compared to here in Florida. So I think that we are dictating. and unfortunately, that just takes us back to that whole we're not united in our um,
Hmm.
treatment, in our um, thought process. And so I would say that the northern states are definitely more diligent than I would say that I see here. And not to say that I think that Florida's come a long way compared to a couple of months ago. Um, uh, at least where I live and where I work, I don't see the gross disregard to mask wearing. I do see them. I don't, you know, back in the summer, even at the height of the pandemic, there were times when I would walk in the store and just be flabbergasted because, half the people walking around didn't have masks on. And not to say there aren't some pockets out there, because we are in full reopen, where they're not enforcing it. But I would say overall, at least in Lake County and in Orange County, I don't see that. I see people wearing their masks. So at least that part we see. Are you seeing the same thing
That's
up in
good.
Sanford? Yeah. So at least we've got
Absolutely.
that.
That's
We've got that. The social. Uh, I hate the word social distancing. The physical distancing. I think that it's once again. I think that it's taken more seriously up north than it is down here. And just from, like I said, observing people, etc. Um, then we have, as far as the to reiterate, um, nobody has that COVID sign on their head. And so the big mistake that I see is that, and that everybody's guilty of, is that, okay, you're a stranger, so I don't know you, so you may have COVID, so I'm going to be scared around you. But if it's my good friend or if it's my family member, I know them, so they can't have COVID. And I think that that's where we're getting into trouble, because it's pretty much everywhere. And so you should actually think of it the opposite. Somebody has to prove to you they don't have COVID. So you should assume everybody has COVID that you come into contact with, and that it's actually the exception that they don't, and that you're going to get much better
mm,
results that way than if you do it the way that a lot of people do, which is assuming that because I know you and you don't look sick, that you can't be sick. Um, and
right.
and so now, are you guys the floors? Are you do you how is it looking as far as in the actual hospital itself? Um, are you is there a significant amount of COVID patients? Do you have a COVID ward, or is it kind of just interspersed and just in
So we
isolation and within the
we've
rooms?
already we had already designated an area in the hospital where COVID-19 patients would be housed. That area, as of the end of the summer, it was really had moved down and there was not many patients in there at all. Now it's starting to tick up again slightly, but it's not overwhelming. It's not even as much as it was in the early part of the summer. But
Okay.
it's like I said, the hospital itself is full. The issue really is that most people now, they don't have symptoms carrying it. Many people come into the hospital, and we do when patients are initially admitted, when patients are going to surgery, or from my purposes, when they're a trauma alert or trauma patient, they all get tested routinely now. So we find that there are a few patients that actually have it who have not exhibited any symptoms before. They felt fine, and all of a sudden they do have it, so they get quarantined. But if it's not so much that we're having a problem with, keeping them in a certain area away from the general population.
Okay. Cool. And I think that um, the like I just had an employee who had to go to the hospital, and the hospitals are getting stretched, so it's flu season, and then you have COVID on top of flu season, and so hospitals are always usually stretched at this time of year anyway, and then you're adding this extra burden on top of it, and then you still have your people that are coming for stroke and for heart attack. And so this particular employee ended up in the hospital for 3 days in the ER, in a they basically convert a portion of the ER to function um, as
If
a
hospital
floor,
floor.
as an
Yeah,
inpatient
and
floor,
that's
because there's no
exactly,
beds in the hospital.
you hit the nail on the head. That's exactly what the issue is now, is not the fact that we are overwhelmed with COVID-19 patients, is that every year all hospitals in America get full from November all the way through January, February. They're already full. But now you have these individuals that are moving in and taking up beds, even if it was, only a small portion, and 1/8 or 20% or 15%. That's still a magnitude of capacity that now pushes the hospital to a brink. So I want to make it clear, it's not that we're overwhelmed with COVID, it's just that we're overwhelmed already, and now the COVID-19 patients are being added across the country. It doesn't matter what hospital you're looking at, that's what's happening. So yes, COVID-19 patients in general are, we're doing better across the board as physicians in treating them. We have a lower, like I said, mortality based on that. Basically, the information is coming out based on the medications that we're giving, whether it be monoclonal antibodies that we're giving now, etc. All these things proposed to a patient coming out of the hospital safely and alive and alert. But the fact that they're there in the first place now puts stress on the entire system.
Right. And they're definitely, yeah. So I can tell you that it's real here. And like I said, it's worse other places. LA County has 10 million um, people in it. And Los Angeles County. And they only have 699 hospital beds, and they only have 69 ICU beds for available still. Um, for 10 million people. So that's a crisis. That's a crisis. And they said it's actually currently not even about the the number, that they don't have the space, they don't have the employees, they don't have the nurses and the doctors to take care of the patients. So you can't be put in a bed and there's no one to take care of you. And so they're stretched. And what happened, and that's why we're going to see more deaths, is because just what happened in New York, where the system gets overwhelmed. But the difference with New York was that people were able to be shipped into New York. They got healthcare workers to get to go to New York. But when it's hitting all the states, then you're needed in your own state. You're not going to see an influx of people coming from other states because the state that you're in needs you. And so that's the problem, is not, it's, there's bed availability there, and then there's also staff availability. And then that takes us to, obviously, for our healthcare workers are our first line people, and if they're getting COVID and they're getting ill, then that takes them out as well, which takes us back to our vaccinations. So we can kind of lean into that. And you, like I said, I know you're busy, so if you need to go away, I will let you go away. He said, Dr. Evans has agreed to come in and talk to us and give us updates every couple of weeks on what's going on. You actually get a break because, like I said, we got Christmas and New Year's. So, so, but that are both falling on a Friday. But if you would like to, you're more than welcome to hang out. But I didn't want you to feel like you had to hang out for the whole time, because I didn't want to. I'm respectful of your time, and I appreciate that you're willing to come on and talk to people. So at any point, you can just give me a wave, and we'll wave goodbye to you. But if you want to hang out and jump, and feel free to jump in into the conversation, if you want to, if you have something that you'd like to add. So you want to stay, or should I let you go right now? What's your thought? Oh, I lost your volume. Hold on. You muted yourself. You've muted yourself. Let's see if I can unmute you. Hold on. It says the guest has muted themselves. Can anybody else hear him? Is it, whoops, I lost our guest. So we just lost him. So maybe that was because he wasn't available to stay. I couldn't hear that. If you guys could hear that, then great. I could not hear what he was saying. So If he pops back on, I will bring him back. And if you guys heard him, hopefully he said farewell. But I couldn't hear him at the end. Um, I'm going to also switch. Well, if you guys can hear me, once again, please let me know if you cannot hear me. And because it sounds a little tinny to me. But if it sounds good to you, I'm going to leave it that way. And welcome, Krista. I see your question about the concerns with the, because you had the severe COVID and your immune system reacted. Up, here he comes back. Hold on one second. Um, let's just see if we can get Dr. Evans back in. Okay. Can you hear me now? Hello? Let's see. Hello? Hold on. You can hear me, Krista. Okay, great. Let me see if we can get Dr. Evans back. Hold on one second.
I can't. Can you hear me now?
Okay, I hear you now. Yeah, I don't know what happened.
Okay.
It said that you had muted yourself. So,
It didn't. I wasn't muted on this sign, but I don't know why. So I just decided re to back out and come back in.
hey, that works. That works out perfectly because it worked because now I can hear you.
So go right ahead. I'm sorry. Go right ahead.
Okay. So I was just addressing one of the questions that Krista had. Krista is, okay, great. So Krista is actually been actually was on the show as one of my first guests early on. She had severe COVID um, and tested negative, and they kept telling her she didn't have it, but she actually did finally get diagnosed. But she had a horrible um, case of COVID, almost died from it, and had some really weird, funky blood issues that came with that. And so she was on a bunch of medications, and so now what she was just saying is that her system has now recovered. She's almost off of all of her medications, which is a good thing. And her concern was about the vaccine. And so since she had developed such an immune response to the actual COVID um, virus itself, whether or not she would be at a higher risk of side effects from getting the vaccine. And that's an interesting question because that's one of the things I have actually done a lot of research this week on the vaccines. And it was interesting because in the studies, they did not test people to see whether or not they had COVID ahead of time. And I thought that was kind of interesting because I would like to see that data. I'd like to see that we know that there are some side effects that go with the vaccination and so I would be interested to see if people that have already had COVID are at a higher risk for having increased side effects compared to somebody that did not have COVID because of the fact that they've already been exposed to the virus. So hopefully Pfizer and Moderna will consider doing that. So the short answer though to you, Krista, is that they're recommending that everyone get the vaccine whether you've had COVID or not. And that if you have obviously active COVID, no, do not get the vaccine. If you know you're actively sick from COVID or anything, you don't want to go in and get a vaccine if you've got any kind of symptoms, any kind of flu symptoms, anything like that. And so any kind of febrile illness, don't go in. Just like you don't go get the flu vaccine if you're not feeling well. So you don't want to be vaccinating in an acute illness. But assuming that you are recovered from the vaccine, from the coronavirus, they are not testing ahead of time. They're recommending that everyone get it. Now, what they're saying, of course, right now is we have a shortage of vaccines. So um, they're saying that you could definitely wait 90 days. We do see that there should be good immunity for at least 90 days. And it looks like it's longer than that. I can tell you that we've tested people 6 months out, and they're still showing antibodies. I have a friend who got coronavirus, moderate illness, not hospitalized, but moderate illness that is still um, got my antibodies at 9 months. Now the question is they're not running titers though, so so titers is how much antibody do you have? So we know that they're testing positive for the antibodies, but is it enough to keeps them from getting reinfected. That's all the big unknowns that we don't know. So anyway, so the recommendation is that it's at least 3 months, and that after that, that you would go ahead and get done. If you are someone who has had severe reactions to vaccines, there are people that already know this. Um, they have reactions whenever they get a flu vaccine or any kind of vaccine. Then they're recommending that you still get it, but that you are watched closely for 30 minutes, and that wherever you get it from, that they're aware of that, and that they're prepared in case you did have a major reaction to the vaccine. So, Krista, what I would say is that you would be one of those people who would do that and just watch you closely, make sure that you're aware. And I don't know. I think we're not going to know that information as far as whether or not there's increased side effect profile in people that have already had coronavirus until we see more numbers go out. The bottom line is, what side effects are we talking about? Okay, so the side effects are still way, 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 way better than the risks that go with getting coronavirus. Okay, so
Absolutely.
and in your case, of the risk of being reinfected with coronavirus. You have something to add to that?
No, no, I agree with everything you've said. Um,
Yeah. So
Waiting 2 to 3 months to get the vaccination is fine. Antibodies are going to last up to about a year. You're right about the titers. We don't know where the titers are meaning how much antibodies are in your body for that time period. I have heard of people once or twice across the country getting COVID-19 a second time, but that second time is greatly reduced in symptoms and very mild, but they're positive as they were tested. I don't know the data on whether or not in the studies they tested people prior to giving the thing, but I don't think they did. But
they didn't.
I think they may have been on purpose because they wanted to see uh, the reactions across the board. I know they tested in every country, including Africa, South Sudan, India, etc. So that's a good thing because obviously in our melting pot of America, we have everyone here. So there's not one group of individual or people that's going to work better than the other. It still came out to be around 94%, and that's actually one of the best efficacies that we've had in any vaccination in our history as human beings. So it's really a testament to some very good work that some people, many of which are Black individuals, who were on the scientists boards and so forth, who were trying to get this thing through. So I'm very proud of what has happened in our medical community.
So Krista was basically saying that she's a little concerned about getting the vaccine. You could certainly, anyone that is concerned, there is a shortage on the vaccines right now anyway. So you can certainly sit back and watch. And I don't think you need to feel stressed. It's not going to be available to the general public um, at this point for probably a couple of months. So you'll be able to see the healthcare workers that are going to be the guinea pigs. And so, I mean, there are no guinea pigs. The studies have already been done. It's already gone through the trials. But one thing I just wanted to clarify with Krista is that this is not a live vaccine. This is not an attenuated vaccine. They are not injecting you with COVID. So please be clear on that. So it's not COVID. So you can't, your body's not going to do that. It's not going to go into a full cytokine storm. Remember, they have actually, even though people, let's talk about some of the concerns that we have. Let's talk about what the vaccine is. So first of all, it's a messenger RNA. So it's basically where the vaccine is injected into your muscle, and it sends a message to your cells to produce the S protein that is part of that spike protein that gets absorbed into the different cells when somebody gets COVID. And that's how those little spiky things, everybody's seen the pictures. So the little spiky thing is how it invades your cells. And we have receptors on many cells in our body, especially in our lungs, in our nose, etc. And that's how the virus is getting in, and that's how it's replicating and becoming more and more and more virus. So the goal is that um, when you get the vaccination, is that your body will form this little S protein, and your immune system will say, "Hey, that's something bad," and it will attack it. And that's why you get the side effects, because it's not you're not getting COVID. You're getting an immune response. And I understand you had a bad cytokine storm, and I get what you're saying. I got you. But the good thing, as Dr. Evans just said, people that get reinfected. So if you're getting reinfected, that's kind of even worse than getting the vaccine, right? They're not having a severe reaction when they're getting reinfected the second time. So they would be the same thing if
Right.
you got the vaccine. You're not going down that path. But I understand you were an outlier. You did not follow the book. So I would definitely say sit back. I think that is, we can always do antibody testing. You can do it every single month, and you could certainly should be one of the people that sits back and observes. And I think that, God willing, your immunity is going to hang out for a minute, and you don't have to be one of the first people that does it. And there are other ones that are coming out too constantly. So we have the two big ones that are the messenger RNA, but the I like the messenger RNA. And so I want to talk to you guys a little bit about the difference, so that we can and we can talk about how it's rolling out and all that fun stuff. So, as I said, it is not a live vaccine. It is not, so there's no coronavirus being injected in you. So, can you get coronavirus from this vaccine? No, it is absolutely positively impossible.
Absolutely
Um,
not.
and yeah, so you do not have to worry about that. That is not even on the list. So I know there's a lot of stuff out there on the internet that is not correct. So you're gonna ask that to kind of like us, just kind of make sure when take everything with a grain of salt, and do try to stay with reputable sites and data, and not get caught up in emotion and just what people are saying. I always tell people the internet, bad news travels 20 times faster than good news, and it's amazing because the untrue stuff seems to travel 50 times faster. And so and I think that's because it gets sensationalized, and also it's a fear factor. If you guys think about it, even just
Right.
watching the news, do you stay tuned to the 11 o'clock news to see little Johnny, won the championship at your local school? No, you stay tuned because somebody got killed, or somebody got robbed, or some catastrophic event happened, and you stay glued to your TV when there's a hurricane or earthquake, or in this particular case, coronavirus, where lots of people are dying. But you're not going to stay tuned for the cheery, fun things. So it's the same thing on the internet. Fear, people, Americans, human beings, period, we just respond to fear. And so if somebody wants to get your attention, they know that's the way to get your attention. And so,
Hmm.
there's that whole fear factor. So you got to let go of that and realize that there is a lot of sound data out here, and you can weed through some of the garbage that's out there and understand that. The other thing is, it cannot get in. It is RNA. It is not DNA. It is not going to get in to your DNA, take over, and start creating little whatever things, little cybers people, or anything like that. It cannot do that. It cannot do that. So that's just it, period, dot. There's no more discussion to be had on that. There are no little trackers in there for the government to follow you. It's the government follows you anyway. And it's amazing to me, these people that are so concerned about stuff like this, about the government tracking them through a coronavirus, but then they have freaking Siri and what do you call her? Alexa in their house, who's listening to every freaking thing. And so it's like, how can you, that's what you need to be concerned about. Don't have a smart TV if you're that concerned. Don't have Alexa sitting there. And your phones, I'm sorry, they can hear anything they want through your phone. So you just might as well get over it. If you got a phone, if they want to hear something, they can hear it. So just get over yourself. Nobody's putting little trackers in it. That costs too much money. Nobody's got that kind of money right now, to be putting those things in you. So don't worry. You're not going to suddenly, it's not the mark of the beast, blah, 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 blah. And just kind of get over that tip. Is it safe? Getting coronavirus and dying is not safe. Okay. Getting coronavirus, Krista will tell you, is horrible. You do not know if you're going to be one of the lucky ones. We don't have that on our forehead either. Wish we did. We'd all be happy. I'd be happy. I'm constantly in fear. I'm sure you're constantly in fear. You're always waiting for that other shoe to drop. What if? What if I get it and I'm one of the unlucky ones? And you don't know. Krista had no side effects. She doesn't mind me telling you that because she came on and she told you guys that she had no underlying medical problems, nothing. And she almost lost her life more than once from this deadly disease. And she's young. She doesn't meet any of the risk factors, none. So you don't know. And so you have to always put that in perspective when you're concerned about something. I get it. I'm not saying, I told you guys this before. Normally, I'm not the first on the block to jump on something. I'm really not. I mean, I usually sit back. I usually watch, I like to see, I want to see what's
Hmm.
going on. I want to see if people are getting three heads or anything like that. But when I sit there and I go over the risk, and that's how what we do that in life, right? You have to manage your risk versus your benefits, right? And when the benefits outweigh the risk massively, as they do in this particular case, I can't do that. I can't. I personally am getting my vaccine, like I said, next week. Are you going to get vaccinated, Dr. Evans? Have you done it or are you getting it?
On Tuesday.
Yeah. So, we are doing it because we're exposed. We're exposed. I'm exposed every single day. And it's scary. And even though we do everything right, yeah, I wear the mask. I have the filters. I've got the air filtration. I wear the thing around my neck. I wear air filtration around my neck every single day. When I travel, I have the shield on. I look like a freaking Martian. And but I don't care because I get it. I understand it. I see the data. I see the data every day. I crunch it every week for you guys. So I get it, and it's scary. So yes, I'm going to get the vaccine because the the benefits outweigh the risk. The other thing is that you have to understand the internet is constantly getting better, right? And more of us have tuned into the internet than ever before because we were suddenly trapped at home, right? And so suddenly we had full access to the internet. And so even people that were not big internet people are now suddenly internet people. So um, that's positive, but it's a negative. But just so we're all clear, vaccination fear is not new. This has nothing to do with just coronavirus. There have been anti-vaccine people for years. It's just it's been ongoing. I mean, it's been going on since the first vaccine never came out. There were people way back that did not believe in vaccines. Yeah. So Irene just asked about whether you should get the vaccine if you've had COVID. So the short answer, Eileen, is yes. If you wait 3 months from when you've had COVID, and yes, everyone should be vaccinated. This whole fear of vaccines, there's always been people out there. I just was on a talk, and they were talking about the HPV vaccine. As you guys know, I'm a gynecologist, and so when the HPV vaccine came out, which is something that's administered to now to um, children, both males and females,
Young.
but in the beginning it was for females. Um, and there was a lot of pushback. I don't want to give my child a vaccine. It's going to make them sexually active. It's going to make them think that it's okay to do this and that, and they're going to have side effects and blah 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 blah. And we went through all of that. They went through. We go through it every year with the flu vaccine. We go through it with chickenpox vaccine. So this is not new to have people that are afraid of vaccines. And so just be aware of that. You have to do what you're comfortable with, but don't think that this is something new because it's not. There's been anti-vaccinators for years and years and years, um, and and we've seen, like say with the HPV vaccine, I can tell you that I've had parents come in. It's like I said, now it's been years. It's been out. I don't even know if time passes, but it's been out more than 10 years, and oh, probably 20. Well, he's probably been out a long time. But anyway, when the HPV vaccine first hit, there was a lot of hesitation, once again, because it was new, and there were a lot of parents that were not sure that they wanted to give it to their daughters, etc. Now we've seen it. The data's been out for years. It's not a big deal. People get it automatically, just like most people get their flu vaccine. And we don't see people with, are there extremely rare side effects? Anything you do, you can get a side effect from. Anything. So, I mean, that's life. There's always side effects, and anything that is actually going to give you a result, there's a possible side effect that can go with that. As we discussed last week, I told you you would never take an aspirin a day in your life if you actually read all the side effects that go with it, and people do it all the time. So we take things all the time knowing that there are potential side effects, but it's that feeling of lack of control, or that somebody's telling you to do something, I think, that makes us feel really nervous and like we're not in control of the situation. We can go to the store, we can buy that, put our hand on that bottle ourselves. We have more control than we feel we have with the vaccine at this particular moment. And I think that that's more of the fear. You agree with that?
Yeah, you said a lot, but absolutely, that's correct. The fear has been around for a very long time, and there's actually reasons for being concerned, even throughout our history as African Americans. But today, and what we do, and the infiltration of us as of people of color in the medical field, I'm very confident that there's nothing to worry about when it comes to that end. And also, just overall, we know that the way that we've cured several diseases in the world is through vaccination. So it's the best thing at this point to do. And there's no, I mean, my unfortunately, my father just was diagnosed with COVID-19. He's doing fine, but I mean, in all these places, my mother hasn't had it yet. I'm going to make sure she has it, the vaccination. So it's important to especially those people who are at risk, the older population, to make sure we get them there, because at the end of the day, like you've said several times, the alternative can be not must, but can be very devastating. And I'd hate to be the one thinking that I didn't do all that I could to prevent that for my family member, my friend, my loved one.
Yeah. And I just had a friend who lost her grandmother within a week. I mean, this far into it happens. I mean, you don't know. So you're lucky your dad is doing well, and I'm very glad to hear that. Her grandmother got it from, someone in the nursing care center, and is no longer with us a week later. So once again, we don't, so
Mm,
there, it's not, thank God, an automatic death sentence just because you're over 65. Um, but obviously, we do know that the disease can be more deadly
mm,
in that age group. They are more fragile and more prone to bad effects. So but you can't just say, well, I'm not 65, and so therefore it doesn't affect me, because once again, you're touching, you're there, you're around your family members. And even if you see, so you might not see your grandmother, but you see your brother, your sister, or your cousin, and then they go see this person, and so we all kind of twine in there together. And so you are exposing, because I see the young people say, "Well, I'm not around so and so," or "I'm not," But if you're around somebody else that then is around that person, it's all going in there together. And so you just have to be aware of that,
yeah.
and do know that. As we know with the coronavirus, that it is very easily spread, and so it's easily killed, but it's highly, highly contagious. And there are just, you have to do the best you can with the information you have. And you certainly want to protect those around yourself as well as yourself. Um, um,
Hmm.
if possible. That would be my recommendation. The side effects, let's talk about those a little bit. The main side effect is actually just is soreness at your arm. I mean, you get tetanus, it hurts. You know that. We all know that. We know that from when we were a kid. Tetanus hurts. You get your tetanus shot because you don't want to die of lockjaw. So, and so a lot of people don't remember why they get their tetanus, but you get it. And you're supposed to get it every 10 years if you guys forgot that little tidbit. So,
I
so,
haven't heard
so
the term lockjaw in a while. That's interesting.
yeah, a long time, right? So, but you do it, and so, and so you're gonna have soreness at your arm. Just get over it. It's okay. You can take. I'm not into pain, so when I go get my flu shot, I always take something for that. So I recommend a non-steroidal, if as long as your stomach and as long as your health is warrants that. And you could even do, and then if you started having symptoms after that, you can take some extra strength Tylenol. Don't drink the whole bottle, but you can do, you could take something. You don't have to sit there and suffer. Then if you, that's the majority, like 80%, over 80% of people are going to get soreness at the site. Then you can
Hmm.
have some fatigue. And just aching is just feeling under the weather. That is your immune system mounting a response. So actually think about it this way.
Right.
You actually want to have a little bit of a reaction because that says that the vaccine is working. And so because it's
Correct.
not that you're getting COVID, it's that your immune system is going, hey, I'm going after this thing. That something is actually happening and it's actually mounting a response, which is what we want. Okay. So don't look at it as a negative, look at it as a positive that that's how people knew in the study whether they got it or not, if they paid any attention, because the people that got the
Right.
sugar injection didn't get any symptoms. So
Didn't
they
get
pretty
that.
much figured out pretty quickly who, even though it was a double blind and stuff, they kind of started catching on really quickly who had the vaccine and who didn't. Um, the the other thing is, now, can you get a fever? Yeah, you can. That is actually it's not as much, so don't worry about that, especially with the first injection. But if you did, it does not mean anything. Once again, you can take some non-steroidal ibuprofen or Aleve. You can take some Tylenol, so you don't have to sit there with feeling crappy. You can certainly do something, and obviously just like you would if you felt sick from anything else, fluids, rest, etc. I've geared my vaccines so that I'm taking them on Fridays, just so that if I had a side effect, it doesn't, wipe me out from seeing patients. So I already warned my husband that I could miss Christmas, but because I'm getting mine the 23rd. But they're saying that the first vaccine is not the one; it's the second one that actually usually has more of the side effects. So that one is scheduled for actually the 3-day weekend for Martin Luther King weekend. So I got 3 days to get over everything if I have a problem. So, but those are the main symptoms, and it doesn't. And so then the question is, oh my God, I'm getting these symptoms. These sound like symptoms for coronavirus. Did I get coronavirus? Okay, let's put apples with apples. Let's not take an apple and a zebra and put them together. If you just got the COVID vaccine, and you're noticing those symptoms, then they're coming from the COVID vaccine. The likelihood that you got coronavirus at the exact same time you did the COVID vaccine is pretty low. Now, let's not go out and do something crazy the same day. Let's not go, well, I'm getting the COVID vaccine, so I'm going to go out and just expose myself as much as possible to the risk of getting it. Because remember, oh, we didn't even talk about that. How fast does this stuff kick in? So the short answer is, if you start having symptoms right after you get the COVID vaccine within 24 hours to 36 hours, then that's probably from the COVID vaccine. Certainly, if you're not feeling good, you should be by yourself anyway, and just kind of resting, etc. And then if it goes away, people that get coronavirus don't usually have the symptoms go away really, really quickly. They don't usually onset and go right away. It can happen, but the likelihood is that, once again, if you just got the vaccine, that it's from the vaccine and not that you have coronavirus. Um, they are not testing beforehand, um, and um, and we already went over that. You do not do the flu vaccine on the same day. So if you're going to get the flu vaccine, get that at least 2 weeks before you're going to do the coronavirus, or vice versa. Not yeah, the corona vaccine. Excuse me. Don't get the virus. And what else? Immunity. Everybody knows, I think, that there's 2 injections. You have to get two. So this is not a one-timer. And you need to go in with that in mind. The first vaccine does. There's some data that it's about over 50% um, increase in immunity against the virus after the first vaccine, but we don't know how long that would last. So don't go in the idea that you're going to just do one vaccine. Go in with the idea that you're going to do two. And the second one, for the Pfizer, is given 3 weeks. You've got a little bit of a wiggle room, like up to 3.5 to 4 weeks is what the hospitals are doing here. But in the study, it was 3 weeks apart. And the second one, after 2 weeks after the second injection, the immunity goes up to over 94%, which is just amazing. So, I mean, we just there's no vaccine out there that's like that. But that's also because the messenger RNA vaccines are um, are a newer vaccine. But that's not a bad thing. Another thing that people are concerned about is obviously because of all of um, the politics that have gone along with coronavirus. Is this being rushed? Is this a government thing, and it's really not been vetted out appropriately? The studies actually were done correctly. The reason the vaccine has actually been in study since early 1990. The thing is that the original, because remember this coronavirus 19 is very similar, not the same, but similar to SARS, which occurred back in the early 1990s, right? And so they were working on a vaccine for that. But then SARS kind of played out on its own. It kind of fizzled out. So no one's going to spend millions and millions of dollars working on a vaccination for a dead disease. It just doesn't happen. So they also didn't have the numbers of people to put in the trials. So if people are no longer getting the disease, they don't have the people to put in the trials to get the, you guys heard about the phase 1, the phase 2, the phase 3. So there have to be a certain number of people that they can test in order to see if the vaccine is good. So the difference, so it's not that it's a brand new vaccine. They were already working on a vaccine similar to help against coronavirus, but it kind of fizzled out because money talks, volume of people talks. So now suddenly, the reason why they were able to do this so quickly is not because they were rushing the system, they just had more access. Suddenly, the government from Moderna said, here's the money. You don't have to put out any money at all, and we're going to fund your research. Well, that's like great. The scientists went, yay, I can do whatever I want. I can get as many people enrolled. I can do all the things I want to do, and I'm not worried about money limiting me. Pfizer, if anybody's interested, Pfizer did not accept government money for their study. Their study was completely independent of the United States, but they did have a guarantee from the United States that they would buy a certain number of the vaccine once it was available, once it was approved and available. So that still, even though they didn't have the money to actually do the research, it still is, if you're a drug company, you don't want to make millions and millions of vaccines and they're sitting on the shelf. So the idea that if they made it and they got a good product, that it was going to move was their reassurance to go forward. And it wasn't just the United States, all the countries are basically backing. That's why you guys know that the drug actually went to the UK first. So if that helps to explain things a little bit, because there is a concern about how quickly it went. There still was 75,000 people that were involved in the phase 3 trials, and so they achieved the numbers they needed. They just moved it quickly, and then yes, they will continue to follow these people. They're going to follow all of us, but they're going to continue to follow the people that are in the trial. The trial is not over; it's still ongoing. But as within any trial, any study, when they see that the data is extremely positive, then it becomes a disservice to ignore that data. You would not want
Right.
that they know that they have a potential vaccine that is 95% effective, and they continue for months and months and months to let people just get coronavirus and see the death tolls going up and see the illnesses going up and all the strain on our, not just our healthcare system, but our whole economy, when they have something that could actually help. So that is why they have rushed for the approval, because they're saying, hey, look at this data. This stuff works. This is a good thing. We need to move on this.
Right. Yeah, you did a very
And
good summation of what has happened with the production plant and also the outlay research and outlay of this the viruses vaccinations for the viruses. That's actually superb. It's one of the best explanations I've ever heard. So thank you
well,
for
thank you.
that. I even thought, yeah, this is great.
You
You
learned
really put
something.
it in layman's. No, yeah, I mean, I learned a lot of it I knew, but I'm saying the layman's terms is what
Right.
people always give a talk way above your head, but no, that's key. The bottom line is what you said is that this is something that has been sought out, searched, and really proven to do what it's was supposed to do. It was supported by in various ways by government entities, but by no means is it controlled by government entities. And the whole goal is, and just like any other, if you're any leader in of any population, you want your population to strive. Yes, you're going to do what you need to do to help the health of the people that you are serving. So obviously that's what happened here also. And yes, I all I can say before I get off is please go out, get the vaccination when you can, when you get a chance to do so. There is a series of rollouts going on, as you've heard over the news, etc. They want the healthcare workers to get, they want the elderly to get it, they want the people in nursing homes to get it, and then they want the general population. But absolutely, it's something that we should all do, and I truly support it.
Yeah. And so the rollout right now, as you said, so the vaccines are already out in the hospitals. We're in Central Florida, and I've been contacted from both hospitals that I have hospital privileges on. And as a surgeon, we're considered frontline. The very front line was the emergency room doctors, the anesthesiologist, and the ICU doctors. And not just the doctors. Let's be clear. Anyone that is dealing with
Hmm.
has exposure to the coronavirus patient. So that means even the cleaning person that is in the ER, that is cleaning in the ER because they're at risk, high
Hmm.
risk. And so it's not just doctors. So nurses, doctors, respiratory therapists, cleaning people, everybody, food workers that take the food into the patients, all of those people were identified first and they were hit and they were given the virus first. Second line are the people like myself, where I'm a surgeon, I go into the hospital, and so I'm at risk, but I'm not at immediate risk because I don't see patients on the COVID floor and take care of actual COVID patients on purpose. And then the third rollout is the people in the long-term facilities like the nursing homes, etc., assisted care living places, etc. And then so that's where the Pfizer vaccines are going. The Modernas are coming next week, and Pfizer's are coming next week as well. And so there's definitely a nice influx of vaccinations. And one of the neat things is that I think that they were a little bit tight when it was just Pfizer. Now that Moderna's there, they're actually letting go. I don't know if you noticed this, but I saw that they started opening up more dates. So as soon as they knew that the Moderna vaccine was definitely approved, they let go and started saying, okay, we'll vaccinate more people with the Pfizer vaccine because we know that we've got more vaccine coming. Whereas before they were just kind of holding out just to be 100% safe that they didn't give out more than they and not have some left over for other people. It will not once again so we have to go through all of those tiers. Then it comes into more the generalized public, and we have the other healthcare workers that are not in the hospital but are in their offices. For physicians, that are and their staff that are in the healthcare field, the firefighters, the uh, and then it'll go into like say the food care workers, and those are still considered frontline. So it's going to trickle down. Then it'll get to the over age 65. Then it'll finally get to the entire generalized public. So you guys have a ways to go. They're saying March before they're getting to the generalized public. Now, once again, that's based on there's two more vaccinations that are on the pipeline that may come in. And then once again, as the numbers start going through, things may get sped up a little bit. But we're almost in January now, so March is going to be here before we know it. But just realize you got time to sit back anyway, because it's not like somebody's going to be knocking at your door telling you to come get a vaccine right this minute. And then the other thing I'll just go over real quick, and then we're gone. The Pfizer vaccine, you've probably heard, it needs deep freezer. We're talking subarctic temperatures, and so that's really going to be in the hospital facilities. Like I'm not going to be able to store that in my office. You're not going to be able to store that in your office. And so the vaccines that will eventually be going out to the public, the majority of those are going to be the Moderna at this point. And then, like I said, we'll see what else is coming out, because the Moderna can be stored in a regular freezer, and then it can also be in the fridge for 30 days, whereas the Pfizer one is really very tight window, only has to be administered very quickly and has to be shipped and maintained at, like I said, really, really cold temperatures. And they're both very similar. They have a little bit of discrepancy, maybe a little bit more side effect profile with the second Moderna injection versus the Pfizer, but not anything, once again, to write home about. The Bell's palsy, don't worry about that right now. You can get Bell's palsy right now by yourself. The numbers were not any higher than in the general population. Remember when they're reporting statistics, they report everything. So if I'm getting the vaccine and I go out the same day or after the vaccine and I get hit by a car, guess what? I could get counted as a COVID vaccine death because I had the vaccine and they're following me in that vaccine pool. So realize they're looking for any potential side effects. So yes, they're going to report that there was a Bell's palsy in those patients, but there was also a Bell's palsy in the placebo group. Okay, so you got to remember that. And there was also, so there's going to be things that are going to fall out, but so far there are no long-term side effects that um, are very concerning at this point. And things will evolve, so we will keep you posted. So everyone, I'm going to let you go. It is 5 o'clock. I want to thank Dr. Evans for coming back on again and staying the whole hour. And I told him he does not have to do that, but I appreciate it. And I wish everyone a very Merry Christmas. But please be safe as always. Do not let your guard down. I know it's a bummer,
Stay
but you
safe.
can still have a good Christmas. And the goal is to be around for next Christmas and next New Year. And you have to take it seriously and
Absolutely.
understand that the decisions you make now can influence what happens next year. And life is precious, and it's certainly more important than an actual one day in the year. So have a wonderful holiday. I will keep you posted as to, like I said, my vaccination. If Dr. Evans is willing, he can give us some feedback on his vaccination, and I'll give you that information as well. And we will definitely see you by the first Friday of the new year, if not sooner. Stay healthy. Have a wonderful weekend. Merry Christmas. Take care, guys.
Merry Christmas.
Bye bye. Merry Christmas. And I got to just find the off button. There we go.